new national guidelines out to help better diagnose miscarriages and support women after pregnancy loss. Here to walk us through is CTV's medical specialist, Dr. Marla Shapiro. Good morning, Dr. Marla. So let's begin by talking about how common miscarriages are and how difficult they can be emotionally for women.
You know, when I think about miscarriage and I think about the women in my office over the decades I've been practicing, it's often grief, fear, and not understanding what this means for now and for the future. Far more common than you think. Conservatively, about 15% of pregnancies can end up in a miscarriage. So that means that usually in the first 12 weeks, they don't go forward. It causes a huge amount of psychological distress, and about a third of patients may actually develop post-traumatic stress disorder. So we often underestimate how impactful this is on a woman in terms of fear and their thoughts about future pregnancy or why this has happened to them.
So what are the recommendations now?
So one of the things that's really important for women to understand is that for most of the times when a miscarriage happens, there's a reason that is out of their control. It's very important for us to remind patients that often no treatment could have changed the outcome that they're about to see. We're recommending that you use ultrasound, so that's a diagnostic image to make the diagnosis. Often we do a blood test to diagnose pregnancy, and following blood tests serially to see if the numbers are rising is not necessarily a good way to know whether or not the pregnancy will go forward. And it's really important that we offer pregnant patients who previously have had a miscarriage, when they become pregnant again, that they have an early ultrasound to reassure them. And one of the most important recommendations is that we recognize that you must screen patients for mental health. You must screen them for the way they're feeling for depression, and offer other treatments or other referrals, because there's an expected sadness, but for some women, that grief and the sense of loss goes on and on and on and really can result in mental health issues.
Okay, the report also suggests more pregnancy clinics as a way for women to avoid going into emergency rooms.
Right, so in other words, early pregnancy units, so that if there is an issue, a red flag, spotting, bleeding, or whatever it may be, that you have access. Because early diagnosis often means if you're close to an area that we can have improved care, we can avoid those emergency visits. Many of these women can be just watched and observed and not necessarily have a surgical intervention, or there can be medication that can help them along with the end of the pregnancy. In the UK, there are more than 200 such clinics. So we're geographically diverse, and it is challenging for us as Canadians, but having access to this would keep women out of the emergency room, keep their mental health protected, and offer them a better transition through something as sad as a pregnancy loss.
Dr. Marla, really appreciate this. Dr. Marla Shapiro is our CTV medical specialist.